Welcoming Dr. David Klein to the microphone once again, and today we're going to talk about a product that is carried in the nutraceutical store at stages of life, and you really, really need this stuff. I take it, and I feel much better for it. My days go better. I feel more on tap, and that is Magic Minerals.
Okay.
This is neat.
Yeah, Magic Minerals, was the first product I put together. It was number one. I did this for my daughter, when she was about 10, and we called it Daddy's Magic Minerals. Now, why did I call it Daddy's Magic? Well, Daddy, that way my daughter would take it, so she had ownership. But what was the magic part about this? Now, the way I explained it to her, is that she can look around at her friends, the people in her school, and so many of them are chunky. Never used to be this way, but it is now. And it's gotten worse since now that she's 28. In the past 18 years, things have deteriorated. We called it Daddy's Magic Minerals because they're like the beans in Jack and the Beanstalk. You throw the magic beans out there, and all of a sudden you too can grow tall and slender like that beanstalk. Well, she did. I was shocked. And she grew to be tall and slender until she went to college. Now that when she was a college kid, I'm not going to take that. And then she gained, I think, 45 pounds. So this stuff is very, very important with regards to maintaining your weight and maintaining your health. So what are magic minerals? Well, there's nothing magical, of course, but what is interesting, is that they act in a synergistic way, which means they act together to get the job done. Now, what's a mineral, and why is this important? People think, well, it's something you take. It's in vitamins and minerals. What's a mineral in context here? You can ask the docs the same thing, and they won't necessarily know. These are usually metal cations. They're elemental. They are elements, But if they're in the appropriate valence state, then your body can use them and absorb them. If they're inappropriate, your body leaves them behind. Is it bioavailable? And that's really the question. If it's bioavailable, it's in the right valence state. What do they do? This is key. Most important message today is, what does a mineral do as it regards to your health? They act as enzyme cofactors. Now, you can take an enzyme. An enzyme is a catalyst. It converts chemical A into chemical B. It has to be done at physiological temperature. We can't cook people at 140 degrees for 60 minutes to get something done. It has to be done within that 97.6 temperature to 101 range. That's really what your body's looking to do. And so what these things do is they act to reduce the temperature and the energy necessary to make these catalytic conversions. So a mineral in context is an enzyme cofactor. It holds the protein together in a particular shape. It's almost like taking a curtain and pleating it. Zinc does that in particular. Zinc is a pleater. It takes a linear polypeptide and pleats it like you would your curtains. You have a sheet, you have a curtain. That's zinc to many of these enzymes. So it gives the enzyme its tertiary structure. Very, very necessary for it to work. So you take something like zinc. It's necessary for almost 200 enzymatic reactions. Magnesium, 400. So the symptoms of missing these minerals hit more than one spot. What's the symptom of magnesium deficiency? There are at least 300. Depends upon how severe the problem is. It depends on your age and what else is going on with you. So what's in this stuff? Now, also, you need to take them in the right ratios. So when you're taking calcium, you should always take magnesium. When you take magnesium, you should always take calcium. When you're taking selenium, you should be taking zinc. The ratios are key. Taking individual minerals can be dangerous. So how much calcium do we have in magic minerals? How much? The answer is 400 milligrams of elemental calcium. That's more than enough for most healthy individuals, young people. Don't really need it. When do you need the calcium? Diabetes, issues with digestion, age, osteopenia, osteoporosis. You need the extra calcium. Can you take it by itself? Yes. Sometimes it's best taken that way, but more times than not, this is a cheaper way, a very inexpensive way of getting a lot of bang for your buck. Magnesium. What do you need magnesium for? Magnesium is interesting. It is the most prevalent of all vitamin mineral deficiencies. It is number one. Magnesium is necessary for over 400 enzymatic reactions. A lot of disease states occur as a result of magnesium. A lot of cardiac issues result from it. Sleep disorder. You can see depression. You can see diabetes. You'll see all kinds of problems happen with magnesium deficiency. So we treat it. Okay, this is terribly important. This stuff is cheap. Honest to God, this stuff is inexpensive for what you get. So how much zinc do you need? And the answer is between 35 and 50 micrograms a day. Milligrams per day. So what are you doing with that? When taken with the Down to Basics, it hits right dead smack in that sweet spot. So we discussed Down to Basics, which is a vitamin mineral product. The Magic Minerals dovetails into it like a piece on a jigsaw puzzle. It adds just enough more to start handling people in their 30s, 40s, and older. So you're going to pick up an additional 25 milligrams of zinc. That puts you dead smack where you need to be. Selenium, another 190 micrograms of selenium. Why is this necessary? Again, as you get older, your body becomes less efficient in the way that it absorbs things. So another 190 gets you there. Copper, milligram of copper. How much copper does it take to prevent an aortic aneurysm? The answer is between 1 and 2 milligrams a day. This adds 1. Very, very important. So copper, same thing for hernias and so on and so forth. It's very, very interesting. Manganese, necessary for cardiac health as well as bone. So 5 milligrams gets you exactly where you need to go. We talked about chromium.
Yeah.
How much chromium does an individual need? Again, 190 to 200 micrograms a day is a basic amount. When added to this, you add this product to Down to Basics, now you're starting to treat adult onset diabetes. And that's an interesting thing. How do you treat adult onset insulin, non-insulin dependent diabetes? By vanadium and chromium's addition. So this is the first jump to it. Potassium, molybdenum, these are minor issues. Boron, for bone health, 45 milligrams a day. Very, very important to get it in. Vanadyl sulfate, an additional 3 milligrams. Sometimes you need a whole lot more than that. But with most people, this is sufficient to keep your blood sugar under control and your weight down. Then the last piece of this, probably the most important thing altogether, is betaine. What the heck did I want to put betaine in there for? And it's simple, because none of these minerals absorb well without stomach acid. The betaine makes your stomach kick out a little bit of stomach acid, just enough to digest these things. Brilliant way to do this. Okay, so if you take 2 of these twice a day, which is the suggested dosage, add that to the Down to Basics, which is 2 twice a day, you've now just kicked it out of the park. Total monthly budget is about $40. It's very, very reasonable, brings blood sugars down, and brings weight under control. It truly is magical.
And therefore Magic Minerals. And again, available in the nutraceutical store right there at Stages of Life Vitamins. And the magic thing that they've done now is they've automated the program. So let's say that you get Down to Basics. Let's say you get maybe some Diabet, Magic Minerals. Let's say you have 5 or 6 pills a day you take, all right? But then you have to run down and keep picking them up, all right? Well, not with stagesoflifevitamins.com, because it's an automatic delivery system that gets this to you, the dosage you need by the day, and it's delivered right to your doorstep at a discount.
And
what a great program.
And a good discount. Okay, so what happens is it shows up when it's supposed to show up, and you have absolute control over this program. Okay, you sign up for it. If you don't like us, okay, you get sick of us or whatever, you can log in and drop it at any time, at any moment. No hard feelings. It's not a problem. And you can restart it if you choose to. Or let's say that you're going out of town. Let's say that you're a snowbird. You're here for 6 months. You're there 6 months. Okay. Let's say that you're going to be gone for 3 months going abroad, so you want to get your stuff early. We can do this for you. It's very, very easy, and you can travel with it. So why is this important? It's like breathing. Okay, if you breathe 12 to 16 times a minute, which is what you do. Okay, 12 to 16 times. I'm not going to ask you to breathe 30 times this minute. Do it for 5 minutes and then stop breathing for 5. You're dead. Okay, your body needs these things on a daily basis. You miss it for 2 or 3 days, you may not feel it. By about the 4th day, you're going to start to feel it. It's odd the way these things go. A lot of folks wander around not knowing how miserable their gut feels, not knowing how miserable they feel, how it feels to sleep properly by taking the right medications. Why? What about sleep? Why? Okay, sleep is not a passive process. It's not like turning a light off. You take away the energy, the lights go off. You're every bit as awake and every bit as alive when you're asleep as you are during the day. Your brain is going through a defragmentation process just like your computer. It has to be done on a daily basis. Your brain has to work right. In order for this to happen, it has to have the right fuel, and it has to have the right lubricants. It has to have the right pieces.
And when you have it on hand, you're going to take it. Oftentimes, you'll fall out of your regimen, you'll forget about buying it, and then you got a problem. SufferNoMore.com, that's all about stages of life to practice, SufferNoMore.com. But be sure and check out today, StagesOfLifeVitamins.com, the real things, assayed, because when you go into a drugstore, you don't know what you're going to get in that bottle. StagesOfLifeVitamins.com.